These are the things you might not know about breast reduction. What better place to start than talking about what is a breast reduction? So, at its core, a breast reduction it's what it sounds like. When the breasts are too big, they can cause a lot of problems. Shoulder pain, back pain, infections under the skin, all sorts of problems, and, even aesthetic issues that some people don't like. So there are a lot of reasons to have a breast reduction done. And the operation is probably one of the most common operations we do in plastic surgery with the highest satisfaction rate in all of plastic surgery. What do you do during a breast reduction? You take care of the breast. There's several things that you address. You remove extra skin, you remove extra breast tissue, and you bring the nipple up into a position that is ideal in that it faces forward and not down to the ground. What are the things that people don't know about breast reduction? Number one, as I said, a breast reduction also comes with a breast lift. And it kind of makes sense if you think about it. Listen, if a breast is really big, usually means that there's a lot of breast tissue inside of that skin and ultimately pulls things down, pulls the nipple down, and it just makes the breast really big. That means not only is there a lot of breast tissue in that breast, but there's a lot of breast skin to hold that breast tissue. So when you want to reduce the bulk, when you want to reduce the volume there, you not only have to reduce that tissue, but you get rid of the extra skin. And in doing so, you lift the breast up, you lift the nipple up into a new position with a tighter, more lifted breast. So breast reduction comes with a breast lift. Now, second, along that line, that means that this breast reduction is a comprehensive operation where we open up that breast. I know it sounds kind of dramatic. We literally open everything up in order to completely rearrange breast tissue to get the result that we want. So a lot of people wonder, well, what happens to that nipple? That nipple is way down here, suddenly it's up here. What do? You take that thing off and slap it back onto a new position? No. The way we do it is we always keep the nipple and areola attached to breast tissue, and more importantly, attached to the blood vessels that feed the nipple and areola so that it stays alive. Then we literally open up the breast. We keep that so-called pedicle of breast tissue going to the nipple and areola. We take the nipple and areola, we lift it up into its new position. We remove a lot of breast tissue, and then we wrap everything together. And that is much more than just slapping things around, okay? With that type of rearrangement, one thing happens that is another thing you might not know about a breast reduction. Where is the excess volume of the breast? It's usually down below, it's hanging down, it's pulling everything down. So we remove the tissue there, we try to lift things up, but in the vast majority of breast reductions, we're doing all that work down on the lower aspect of the breast. Even after you lift things up, you usually don't get a lot of fullness in the upper aspect of the breast. And because of that, often people who are undergoing breast reductions will need to have other procedures done if they want to enhance the volume up here. Sometimes you can add a breast implant at the same time as a breast lift, although that's kind of rare because the breast implant actually can cause problems if it's a larger breast reduction. And you may need to stage it. Sometimes you do the breast augmentation a few months after a breast reduction. Another way to add fullness up in the upper aspect of the breast is to actually do a fat transfer, where you can use your own fat taken with a liposuction, transfer it up into the upper aspect of the breast to give some more fullness. Or now we often will use alloclay, which is cadaver fat, that we take and we transfer up into the breast that may have some good long-term stability and may even be more than long-term, possibly permanent. And then finally, something that I will often do at the same time of a breast lift or a breast reduction is what's called an auto-augmentation. Instead of simply tossing away all that breast tissue that we're trying to get rid of down in the lower part of the breast, I can take some of that breast tissue and literally swing it up into the upper aspect of the breast to provide some fullness. Literally take from Peter, or steal from Peter to pay Paul, and put that tissue up there and wrap things up. So that's called an auto-augmentation, where we use your own tissue to get this great result. Another thing that is a really big concern for a lot of people with breast reduction is the scar. A lot of people are concerned that the scars uniformly are bad. They just look crazy. There's a big, scar around the areola, vertical scar, and possibly a scar along the whole lower aspect of the breast. That's kind of a downer for a lot of people. They don't want that. So, can we do this operation with no scars? No, sorry. I tell my patients there's no such thing as a free lunch. You've got to pay the price of this operation in terms of scar. But the management of these scars has gotten so good, and there are so many options that I don't think that should hold you back. We are able to sort of preemptively manage bad scars by preventing them, and that comes from good surgical technique, that comes from great scar management techniques after surgery with different patches and scar gels and all sorts of things like that. And it can come in the way of other modalities like laser, microneedling, even medical tattoo after the fact. So my general protocol right now is I use something called silk tape, which is this amazing silk mesh that gets on there and stays on for a good 1 to 3 months after surgery. I then will transition to either a special paper tape or a silicone sheet, and then I will transition to a silicone gel. We can work with our patients on this for sometimes up to a year to get them those scars optimized. And if at any point there's any issue with the scar, we can intervene. We often will do steroid injections. We'll often send to our dermatologist friends or help with laser treatments and all this other stuff. So I wouldn't be worried about the scars, but it is definitely something you need to know. I'm gonna close it up with this. There's a lot there. This is a big operation with a lot to think about, but it goes back time and time again to the fact that this is the operation in all of plastic surgery that has the highest satisfaction rate among the patients, and it's for a good reason. Their lives are changed after this type of operation. They love it, we love it, you should love it too.